I mean, Louise has been absolutely brilliant. So we are hugely lucky that it was Louise that came to us, because I think it would have been a very different experience if we'd had a student that needed a lot more support. Louise has completely hit the ground running with us, really. She's massively helped in terms of picking up some of our workload. She's been seeing patients on her own. And that saves us clinical time. So although we invest a lot of time in sort of educating, teaching, she's shadowing us and things to begin with, we're really reaping the benefits of that now, because she's flying solo with supervision from us. She's doing really, really well. So I do feel like we'll feel her loss when she's gone. Like, we're going to feel that on our waiting list.
We're a very small team as well. So there's 3 of us and we're all part-time. So that has been a highlight and a negative, I would say, because I think because it was so new to us starting in this role, she's really kind of grown with us, hasn't she? And I think she's become quite comfortable. She's had her own desk.
Yeah,
it's all been, she knows where we are, so it's easy in that way. But I would say from a challenge point of view, it was 3 part-time workers in the team and a 12-week paid placement. That really is tricky, and make sure that on the days we're not in, she's covered and she can go out and meet with someone. Whereas when you're in a larger team with more MDT, it's much easier for that student to blend in with the rest of the team, but that has been a bit of a challenge.
Yes, and I suppose that would be quite a common theme in primary care, where you've got smaller teams and a lot of people do work part-time.
And we are the biggest PCN OT team in it. The other PCNs have 1 OT who work part-time, so you can see how there would be a difference.
I mean, it massively helps sharing a student than trying to have a student on your own when you're part-time. That, just shares the concern about booking in those days when you're not in, and making sure that they're safe, really. That's our priority when we're not here, is that Louise is safe, especially if she's visiting, that we know that there's someone checking in on where she is, that she's got someone to report back to, and things like that.
Okay, brilliant. And are there any highlights in terms of your own practice that you felt having a student has helped with?
Getting things like our leaflets organised. So we, as part of a new service, have been developing some leaflets that are helpful to us when we're out on visits, and we're doing a lot of signposting. So Louise has helped develop like a seating guidance leaflet, and again, that saves us time, her doing that, because